We haven't talked COVID in a little while. There was a press conference last week. Dr. Luc Boileau, our public health director here, talking, I think, as much about flu as he was about, of course, COVID. But there's a couple of things here you have to consider, right? There's still people getting COVID booster shots, and there's still people now, of course, wanting to get flu shots because we're coming into that season, right?
Well, and I think a lot of people are in the same boat as me because there's been another little wave of it going through the community, right? So, like, our whole family had it. Like, it's been, I think I'm day 15 now since we contracted it. And so, again, what do? Should you still go out and get your flu shot? Yeah. Do you get your booster shot? How long do you wait? I think there's a lot of questions.
To answer that and other questions, perhaps, Dr. Chris LABOS joins us right now, cardiologist with a degree in epidemiology, who, by the way, you can hear Sunday mornings here on CJD, 8 to 10 on Weekends with Ken. Dr. LABOS, thanks for being with us again today. So let's address Natasha's concern, and I'm sure that's a concern for many. Here's a case where someone came down with COVID now about 2 weeks ago.
Yeah.
So I would guess the rule is if you were going to get another booster shot, do you still have to respect that 5-month rule because you just had COVID?
Yes, you do. So you sort of look at getting a COVID infection in the same way that you sort of look at having gotten a booster shot. So you wait a minimum of 3 months. The sweet spot is probably closer to 5 months. So 5 months is the official rule or sort of the recommended interval, but you can get another booster shot after 3 months. And that's because after an infection, you are going to get a bit of an upsurge of your antibodies. So there's no point in getting a booster if your antibody levels are already high. You need to give them time to come back down for the booster shot to have any benefit. So you're looking in that minimum 3, probably closer to sort of 5-month interval, but the official recommendations from the government are 3 months after a COVID infection.
I have to tell you, because, again, it was going through the community. A bunch of people here at the office had it. I've had so many people asking me questions about it, Dr. LABOS, and I feel like we're ill-equipped. Like, I'm so glad you're here saying that, but people still don't really know what they're supposed to do. And I'll tell you a question I got asked a lot was, well, can you still catch another variant? Like, once you've had it recently, you're supposed to have a certain level of immunity, but does that extend to other variants?
It depends how different the variants are. So early on in the pandemic, there was the original strain and then there was Alpha, and those were similar enough that it was rare for people to have gotten it twice. And then Delta came along, although it didn't have that much of an effect here in Eastern Canada. It was more a problem in the West. But when Omicron swept through this country, because it was significantly different from both the original strain and the Alpha variant, that's why you saw a lot of people getting reinfected, and that's when you started seeing stories of people getting, COVID twice or 3 times. So if a new variant emerges that is significantly different from BA.5, which is what's the dominant strain now, it's not impossible that people could get reinfected because there are people who have gotten COVID multiple times. You probably are going to have some reasonable degree of protection for the first few months, but again, as immunity wanes and as the variants change, that's when you have the risk of reinfection. If we only had one and not the other, we might have been okay, but you have this sort of two things working against you as time progresses. Your immunity wanes a little bit, but the virus keeps mutating and looks different to your immune system, which makes it harder for your immune system to mount that antibody response against it.
Natasha had her COVID case a couple of weeks ago. I had COVID back last December, and I was just going to ask you to describe the variants. Will we ever know, or do the authorities know, if you've already been to get your vaccine, what variant you did have?
No, I mean, there is a way to do that. You can actually, if you were to go for a PCR test, you could sequence that. The only way to know which variant you had is to do genetic testing on that variant, and you could do that. There's no real advantage to doing so beyond sort of satisfying people's curiosity because it doesn't change treatment, and it's not really going to change the recommendations with respect to the booster shots. If you had COVID a long time ago and your last booster was a long time ago, you should probably get a booster shot now to carry you through the winter. If you just got COVID recently, you can afford to wait a little bit and then see how the situation evolves. If 3 months from your COVID infection, things get really, really bad over the fall and winter, I would probably do the booster on the earlier side. If things stay quiescent, you can maybe wait a little bit longer. So it's always about reassessing the degree of risk. But at least for the first 3 months after an infection, you probably are going to have a fair degree of fairly broad spectrum protection, but it's not absolute, and so I would still be a little bit careful. And I mean, the little bit careful is really very simple things. If you're going to be in a public space indoors with a bunch of other people, I mean, wear a mask. It literally costs you nothing.
Mm-hmm.
Can I ask then, with respect to the flu shot, which I brought up at the beginning, so we're now heading into what would typically be considered that season. Is there any reason not to get a flu shot, regardless of whether you had COVID or not?
And can I just add to that, because something that other people have been asking me as well, with the flu shot, that doesn't add any protection for COVID.
No, it's a completely independent thing. It's like, getting car insurance and getting home insurance. You should do both of those things, but one doesn't give you any protection relative to the other. Okay. So if you're due for your COVID booster, and most people are going to be due for their COVID boosters now-ish in the fall, get your COVID booster. And when it comes time for you to get your flu shot, get your flu shot, because I think a lot of us are afraid that this is going to be a pretty bad flu season, because for the first time in 3 years, people aren't walking around wearing masks.
Right.
I mean, we had no flu in Canada. We had no flu season for 2 years because people were walking around wearing masks, and now we've abandoned that for, unfortunate reasons. There could be a very significant resurgence of the flu, so I would get a flu shot to give you that extra degree of protection.
I just wanted to ask with respect to COVID indicators, because that's always the question, right? Here we go again. You know people who are getting sick. Maybe it's anecdotal or not. Are you seeing COVID indicators going up in Quebec?
I mean, a little bit, yeah. Here's the thing. You were starting to see the indicators going down over the course of the summer. I mean, here's the other thing, too. I mean, if you wanted to go back and look at the curves, you can do that. The government puts them all up on their website. We never went down to zero after December, January, after the Omicron wave hit. Because in previous waves, we eventually went back down to zero. We never went back down to zero after this. So there's always been a lot of COVID circulating, but things were trending down over the course of the summer. And very recently, they've kind of plateaued, and now there's the hint of an upswing. So I think this is what people were sort of expecting. We're getting into the fall, we're getting into the winter months. People are spending more time indoors. School has started. A lot of things are going to start favoring the spread of the virus. The big wild card is going to be, does a new variant emerge or not? If some of these new variants that we're already starting to see signs of new variants elsewhere, if they start to become the dominant strains and are more infectious and are different enough like Omicron was, it could be a repeat of what we saw with Omicron. But if they don't become the dominant strains, if what we have now remains the status quo, then maybe things will be okay. I mean, we probably would have been okay in Canada had Omicron never happened. We probably would have seen the quote-unquote end of the pandemic last year, but it's really this issue that new variants are a little bit unpredictable, and we don't know how they're going to behave until we actually see it happen. And
I guess it'll depend on how our government, the CAQ back re-elected, how they will handle this, whether they'll bring back any health measures if needs be. We'll see, I guess.
Yeah, and here's the thing. Regardless of what the government does, people can still do at least the things that are important to them, and that is, honestly, get your booster shots and wear a mask in a public space. If you do that, you will at least protect yourself as much as you possibly can.
Great advice.
Dr. Chris Labos, thank you so much. We always appreciate you giving us some time. Thanks again.
My pleasure. Take care.